Okay, Assalamualaikum to Prof. Dr. Muhammad Khairi bin Mahyudin. My name is Nur Abida binti Ayub. My matric number is 3201349. Okay, currently in semester 1 in Master Counselling Drug Abuse, also named as SPADA at USIM Nilai. Okay. This presentation today is about interview report of a drug addict client, and this report a part of my assignment to the subject of a psycho-spiritual approach in rehabilitation. Okay, this presentation I divide into 5 main part, which is introduction, okay, client demographic, the factors, suggestion, and the conclusion. Okay, this interview focus on the client religion background and discussion in the main factor and solution to cure drug addiction, which support the fact such as Al-Quran and the other facts. Okay, the interview season has to be held at a client house at Alostar Kedah. This season interview took about 2 hours. Okay, the result of an interview report may be limited, okay, but very interesting. Okay, overall is show that the lack of religious knowledge, social culture and environmental factor cause the client to be involved in sustained abuse. Okay, this is my client demographic. His name is Ahmad, not real name. Okay, he is 31 years old. He is a Malay and a Muslim. Okay, he is still single. He's done his work. His education up to the form 5, but he did not take the SPM examination. Okay, the client is the 5th child of a 6 sibling in his family. Okay, this is a client background. Okay, the client was born at the black area, which a serious social issue. His village located in the middle of a city in Alostar Kedah. Okay, he grew up in a family that had a family conflict because his family business was trouble at the time. Okay, he feel lonely and less attention in his family. Okay, he spent most of their time and energy as adolescent involved with drug addiction. Okay, he began to try a cigarette at the age of 14 years old under his friend's influence. Okay, he then take the cigarette silently outside the house. Okay, then he started the practice of inhaling glue. Okay, finally he has experience trying various drugs such as marijuana, morphine, ketamine and methamphetamine at the age of 19. Okay, then he was arrested and jailed for a 6th time in the various drug abuse offense. Okay, his experience 2 times for treatments in rehabilitation center. He relapsed until now. Okay, this is my client drug use timeline. Okay, this table show that the client history of drug use. Okay, according to the client story, okay, before engaging in drug addiction, the client did not fulfill his Muslim rule. Okay, client do not pray and never fasting. Okay, he has never been involved in social and community activity and does not hang out with a neighborhood. Okay, even though his house was near to the mosque. Okay, he did not go to the mosque for praying or religious activity. He chose to go to the port instead of going to mosque. Okay, when he's come out from rehabilitation center, he practiced the Muslim rule for about around 2 months. Okay, after that he forget and do not perform it anymore until now. Okay, this slide discuss the factors that cause the client to involve with drug addiction. I divide into 3 factors. factors, which is religion factors, family and peer influence factors. Okay, the first factor is religious factors. Okay, lack of religion knowledge indicate that a client do not control themselves for contributing to addiction. Okay, lack of religion affiliation and involvement are the main factor contributing to client addiction. Okay, the second factor is a family conflict. The client has a pressure and stress from the family context or cohesion, which a conflict of parents and sibling relationship. Okay, when a broken family structure, okay, early adolescent will experience emotional tension and feel insecure. Okay, they will express his feeling of stress in the form of wrongdoing done at home and school. Okay, the last one is a peer influence factor. Okay, it is easy for positive and negative influence to penetrate the root of a thought and form their belief system and value that may be difficult to correct with adolescent character. Okay. The result of this interview show that the client never stopped taking drug and never say no to drug when his friend asked him to try the drug during his adolescent years. Besides, the client never reject peer when they offer the drug. Okay. It means that the client are ready to assume all the risks to be faced and feel a great thing if they can do drug psychic activity with a friend and give satisfaction to themselves. Okay, these slides are about a suggestion to cure the addiction. Okay, Muslim must obey Allah Subhanahu Wa Taala command and believe. Okay. Change the Muslim are obliged to call of their Muslim for good and prevent all wrongdoing, amar ma'ruf nahi munkar. The relationship between parent and their child cannot be compared to other as in the world. They should take time paying attention to their children to not catch up in a criminal matter, especially in drug abuse. Okay. Okay, the strong support system for ex-prisoner. Okay, next, change the stigma about starting abuse, and it's essential to include a significant psychoeducation component. Okay, the conclusion. Okay, the client as a Muslim should adhere to the religion. Okay, Islamic thought view the heart as the center of a physical and spiritual. Okay, the impact of addiction cause not just physical but also psychological difficulties. Okay, furthermore, a parent must play a vital role in providing social support for their children. Okay, however, okay, the support and help from family member and peers are required to help addiction. Okay, beside that, the inner strength of the individual is visual to deal with addiction problem. Okay, apart from family support, helping from community is essential. Okay, that's all my presentation. Okay, thank you for watching.